Hello everyone, myself Dr. Pratik Kar. So today we will discuss about anatomy of larynx. We all know larynx is an structure or a part of the body which is mainly functioning as a respiratory organ, as a organ to produce the voice and also a protector of respiratory system. Now, so what is larynx made up of? It consists of total three paired cartilage and three unpaired cartilage. So what are the unpaired cartilage? The first one is the thyroid cartilage, as you can see in the diagram. So this above one, this complete structure is my thyroid cartilage. Then comes a cricoid cartilage, and then comes the epiglottis. Here you can see this leaf-like structure. This is my epiglottis. So epiglottis, thyroid cartilage and cricoid cartilage. These three are unpaired cartilage of the larynx. Out of which thyroid and cricoid, these both are hyaline cartilage. Both are hyaline cartilage. Whereas this epiglottis is basically elastic. It is elastic cartilage, and because of elasticity, whenever it falls over the arytenoid, or we can say corniculate cartilage, no injury happens because it's an elastic cartilage. So look at this diagram. Whenever we are ingesting the food, what does this epiglottis do? It fall or rest over this arytenoid and the corniculate cartilages. So it closes the opening of the larynx, and thereby the food can't be entered into the larynx or airway. Now, what are the three paired cartilage of the larynx? The first one is the arytenoid. As you can see, this is my arytenoid. So these are two in number. So paired cartilage are arytenoid cartilage, then comes corniculate cartilage, and then comes cuneiform cartilage. So basically arytenoid, corniculate and cuneiform, these three are paired cartilage of the larynx, and out of which this cuneiform and the corniculate, these are also elastic cartilage, whereas this arytenoid, it is hyaline cartilage. Why I am discussing this? Because it's important for examination point of view. The unpaired cartilage of thyroid, cricoid and epiglottis, out of which the thyroid and cricoid are of hyaline nature and the epiglottis is of elastic nature. If we talk about the three paired cartilage, then first one is the arytenoid, which is also a type of hyaline cartilage, and then comes corniculate and cuneiform cartilage, which are also elastic cartilage. And corniculate cartilage, it is also known as cartilage of Santoroni, and cuneiform cartilage is known as cartilage of Risborough. Now this larynx is developing from the fourth and sixth branchial arch. We know what is the nerve of the fourth branchial arch. It is superior laryngeal nerve. Superior laryngeal nerve. And what is the nerve of the sixth branchial arch? So nerve of the sixth branchial arch is recurrent laryngeal nerve. So basically this complete larynx is derived from fourth and sixth branchial arch. Now let's talk about the individual cartilage. This cricoid cartilage, it is the only cartilage which is complete ring. As you can see in this diagram, this is complete ring. So cricoid cartilage is the only cartilage with a complete ring, and it is also known as signet ring. So any injury to the cricoid cartilage or any injury to larynx or subglottic area, so how does it will heal? It will heal by the fibrosis. So any injury will lead to the fibrosis, and this will result in laryngeal stenosis, or also known as subglottic stenosis. We are talking about the injury to the cricoid cartilage. And look at this diagram over the cricoid, how this arytenoid cartilage is resting. As you can see, so these are arytenoid cartilage. You can look at the arytenoid cartilage. It is having the vocal process, both the sides, and these vocal processes are further attached to the vocal ligament, forming the true vocal cords. So how does true vocal cord forms? So posterior 1/3 of the true vocal cord is formed by the vocal process of arytenoids. And you can see this arytenoid bone is also having the muscular process and apex and other facet for insertion of certain muscles that we will discuss in later slides. Now we talk about thyroid cartilage. So in the male, this thyroid cartilage, it's not a complete cartilage. It is open posteriorly. So this cartilage has an angle. So it is 90° in the males, which is responsible for formation of Adam's apple. This you can see a prominence here. So this is because of the angulation in the thyroid cartilage, or we can say angulation at the level of thyroid notch, which is 90° in the male, responsible for forming Adam's apple, whereas in the female it is 120°. Now there is an important sign which is known as Boca's sign or Mure's sign. So what is this? Whenever a patient with any laryngeal pathology, suppose patient is suffering from the laryngeal carcinoma, so what will happen? See, this is my trachea, thyroid cartilage, sorry. So this is part of the larynx consisting of thyroid cartilage. So just try to move this over the vertebra. Suppose if there is no in between structure between the vertebra and the thyroid cartilage, so we can feel a crepitus or some sort of sound, some sort of friction. But if there is some malignancy of the larynx, so if we try to move it, we can't feel that crepitus, we can't feel that friction. So that is known as Boca's sign or Mure's sign, and it is somewhat pathognomic of carcinoma. And it has been asked in the exam. Every point we are discussing about the laryngeal anatomy is important for the examination point of view. Epiglottis we have already discussed. It is a leaf-shaped cartilage made up of elastic cartilage. Now what are the part of the larynx? Look at the diagram of the larynx. This is a complete diagram. As you can see, this above one, this roof, this leaflet-like structure is my epiglottis. So larynx is basically into three parts. First one is the supraglottis, then comes the glottis, and then comes the subglottis. So how you divide, till what extent this is supraglottis or glottis? So look at the diagram by the dotted line. You can see the structure or the part of the larynx above the level of the vocal cords is supraglottis, and this constitute around 61% of the larynx. So what are the structure or what are the parts which are coming under the supraglottis? So these are firstly the epiglottis, then comes arytenoid, then comes quadrangular membrane, which is above the level of the vocal cords, and then false vocal cord is also a part of supraglottis. Don't get confused that false vocal cord is a part of glottis. No, the glottis means only the true vocal cords. So false vocal cord, then comes the ventricle. What is the ventricle of the larynx? As you can see, just try to look. This is my false vocal cord, and there is a depression or invagination, and this is my true vocal cords, okay? So this area, I'll mark it by the yellow color. So this area, so this is the area which is my ventricle of the larynx, or we can say sinus of Morgagni of larynx. So this area or the invagination of the mucosa or recess-like area between the false vocal cord and the true vocal cord is ventricle of the larynx. So ventricle, false vocal cord, then arytenoids, aryepiglottic folds, quadrangular membrane, epiglottis, all these are parts or structures related to supraglottis. So what does the glottis consist of? This glottis is made up of the true vocal cord, as you can see in this area. So this is the thickness of the true vocal cord, and it constitutes around 26% of the laryngeal total area or total part. Then comes a subglottis, which is the narrowest or the shortest part of the larynx, constituting around 13% of the larynx, and basically it is the cricoid area, you can say. Now there is one other term which is known as epilarynx. So what is this epilarynx? See, epilarynx is the area or structure which we call is whenever the epiglottis fall over the arytenoids. So that inlet, laryngeal inlet, is known as epilarynx, which consisting of firstly the arytenoids, then comes the aryepiglottic folds, then the interarytenoid area, and suprahyoid epiglottis. So just try to look at this diagram. Suppose these are my arytenoids. Suppose this is my cricoid cartilage, and this is my arytenoids, and these are aryepiglottic folds, and this is my epiglottis part. Okay, so this is my epiglottis. These are aryepiglottic folds. These are aryepiglottic folds. This is my arytenoid cartilage and two arytenoids. So entire area is there. So this structure, the suprahyoid part of the epiglottis, aryepiglottic folds, arytenoids. So this will constitute the epilarynx or area just covering the laryngeal inlet. And laryngeal inlet, if we talk about, that is also formed by the superior part of the arytenoids, aryepiglottic folds, then comes the epiglottis, interarytenoid. So I hope this is clear. Now glottis, this is the narrowest in adults. If we talk about the subglottis, which we have discussed, which is the shortest part, subglottic area is the narrowest part in children's, whereas the glottis, it is narrowest part in adults. So how does these vocal cords are formed? So vocal cords are basically formed, posterior 1/3 is formed by the vocal process of arytenoid, this we have already discussed, and anterior 2/3 is formed by the cricovocal membrane. Suppose this is my two vocal cords. So posteriorly this much part is in part which is the vocal process of arytenoids bone, 1/3 part, and the rest of the part is formed by the cricovocal because it is attached to the cricoid and this is attached to the vocal. So vocal and cricoid part junction structure is known as cricovocal membrane, which is formed by the conus elasticus, which we will discuss later. So vocal cord anterior 2/3 is cricovocal membrane, which is a membranous part, and posterior 1/3 is vocal process of arytenoid. And that is a reason why some of the nodules, some of the pathologies, any major trauma over the vocal cords, they will produce lesion at this site, the junction of anterior 2/3 and the posterior 1/3, like in TB or some other pathology. Most of the lesions are also produced in anterior 1/3 and the posterior 2/3, but this junction is also related in some of the disease like the TB or the larynx and other pathology. Now, larynx, the important part is complete respiratory system. If you talk about the bronchus or the lungs or the larynx, it is mainly lined by the pseudo-stratified columnar epithelium. Whereas, try to remember the vocal cords, the true vocal cords I am talking about, or the upper part of any epiglottic folds and the lingual part of the epiglottis, the part of the epiglottis which is facing the tongue. So these three parts in this respiratory pathway, they are not made up of pseudo-stratified ciliated columnar epithelium, but consisting of squamous epithelium. So try to remember, true vocal cords, the epithelial lining is not pseudo-stratified epithelium, but it is squamous epithelium, and that is the reason why some sort of keratotic plaques are forming in the true vocal cords, some nodules are forming in the true vocal cords. Okay, now we already discussed the fourth branchial arch and the sixth branchial arch, and there is a nerve supply. Fourth, it is superior laryngeal nerve, and the sixth, it is recurrent laryngeal nerve. So it is supplying, forming the cricoid, and the fourth superior laryngeal nerve is formed by the epiglottis. And again, this has been asked in the previous exams. Now, what are the membranes of the larynx? See, the extrinsic membrane are there and intrinsic. Extrinsic, by the name itself suggests the membranes lying outside the framework of the larynx, and intrinsic membranes are the membranes which is lying inside the larynx. So what can be the extrinsic membrane? The first one is thyrohyoid. That means the membrane connecting the thyroid cartilage and the hyoid bone. So outer part. So that is thyrohyoid membrane, and it is supplied by the internal laryngeal nerve. That is a sensory supply to the supraglottis. We all know the larynx nerve supply. The above one is a superior laryngeal nerve, which is further dividing into two parts, internal laryngeal nerve and the external laryngeal nerve. So this internal laryngeal nerve is a sensory supply to the supraglottis. Okay, and superior laryngeal vessels, these are piercing the thyroid membrane and entering into the larynx. Then what are the other extrinsic membranes? Other one is a hyoepiglotticus, as the name suggests, the membrane connecting the hyoid bone at the epiglottis, and the last one is a cricotracheal. Okay, cricotracheal will be the below the level of the cricoid cartilage and the trachea. So these all are extrinsic muscles. Then come intrinsic membrane of the larynx. Sorry, I told extrinsic muscle, not muscle, but the extrinsic membranes. Now let's talk about intrinsic membrane. The first one is cricovocal, or also known as conus elasticus. So this cricovocal, as the name suggests, the membrane between the cricoid cartilage and the formation of the vocal cords, which we have already discussed. So this is also known as conus elasticus, which is forming the true vocal cords and anterior Broly's ligament. Okay, and this is interior part of the cricothyroid. Then comes a quadrangular membrane, and rest of the structure are formed by the quadrangular membrane, like the aryepiglottic folds or false vocal cords, like the ventricle area of the larynx, and ventricular folds, vestibular folds. So try to remember, false vocal cords are formed by the quadrangular membrane, whereas the true vocal cords are formed by the conus elasticus. Now, what is the laryngosele? Any invagination. See, we all know about the ventricle of the larynx, where we have seen the area between the false vocal cord and the true vocal cord. Suppose in this gap, sometime the mucosa may herniate or may invaginate, forming a saccule, and whenever some collection of the fluid occurs there, so it is known as laryngosele. And again, this has been asked in the exam. Now try to understand what we have discussed about the membranes. So this is an anatomy of the larynx, where we can see the thyrohyoid ligament. This is a ligament connecting the hyoid bone above and the thyroid cartilage below. So this is thyrohyoid ligament, which is an extrinsic ligament. Then other one is a cricotracheal, which we have discussed. So this is my cricotracheal ligament, which is again the extrinsic membrane, as you can see, between the cricoid cartilage and the first ring of the trachea. Okay. Then what are the intrinsic ligament? So intrinsic, the first one is a cricothyroid ligament. As you can see, between the cricoid cartilage and the thyroid cartilage. So this is a cricothyroid ligament, which is an intrinsic membrane. Okay. So this is a basic idea. Now try to look at inlet of the larynx, where we can see the leaf-like structure of the epiglottis, and all around is the thyrohyoid ligament. And try to look out at this is my vocal ligament. As you can see here, not very clear in this picture. This just to brief an idea how the larynx membrane or the ligaments are forming. Now let's talk about the membrane. We have discussed about the intrinsic membrane. The first one was a quadrangular membrane, which is also known as quadrate membrane, as its shape is like a quadrangular. So you can see between the epiglottis and till the level of the thyroid cartilage. So this is my quadrangular membrane, and the lower one at the level of the cricoid and the vocal process is my conus elasticus, or we can say cricovocal membrane. So got an idea how the conus elasticus is forming the cricovocal membrane, and area between this area, I'll mark it by the yellow. So this area is the area which is known as sinus of larynx. So I hope you are having some idea how these membranes are getting formed. Now what are the lymphatics? The supraglottis, these are always draining into the upper deep cervical lymph nodes, the upper part of the deep cervical lymph node. And if you talk about the subglottis, that is the area adjoining to the cricoid cartilage or below the level of the vocal cords, these are draining into prelaryngeal or the pretracheal lymph nodes. We all know that trachea is also draining into the pretracheal or prelaryngeal lymph node. So the subglottic part is draining into prelaryngeal or pretracheal, supraglottis into upper deep cervical lymph nodes. So glottis, point to remember, it doesn't have any lymphatics. Okay, so the vocal cords, true vocal cords, they are not having any of the lymphatic supply. So that is a reason, if suppose patient is having carcinoma of vocal cords only and it has not spread to the other structure, so we are pretty much sure that it is not spreaded via the lymphatic system. So we can do the cordectomy if the lesion is localized to the vocal cords only. So that's how we decide what to do in any sort of malignancy or any sort of lesion, according to the lymphatic supply. What are the functions of the larynx? We all know protection of the lower airway. How does it protect? The epiglottis fall off, closes the laryngeal inlet, so avoid entry of any pathogens or any food particles into the airway. Then comes the phonation. We all know by the help of the vocal cords, abduction and adduction, we can phonate. Then comes the respiration and fixation.